Hello, lovely people. It's your girl Agape. Hope you had a good Christmas. I had a good Christmas. So, today's topic is a continuation of the part 1 I did earlier on about how I got on as a midwife after my midwifery training. So, if you could recall, I stopped at when I was posted at the health office in the local government. So I stayed in that office for a while. I learned quite a lot from Mrs. Amobi and my colleagues. I had 2 colleagues I was working with. Our job is office work, as I stated earlier on, but also distribution of items to the local government health centers. People that are conversant with the health care settings know they are the first port of call for people to get their treatment, to get their health care checked before they can proceed to the hospital. So we do a lot of work. We do maternal and child health care services like immunization, deliveries that are not complicated. We do circumcision, treatment of minor ailments, and then we can refer them if it gets beyond our capability. So usually the health centers are equipped with staffs that did public health, or like myself that have done my nursing and midwifery. We also have healthcare assistants of different grades, and then we have cleaners. It's a small setting, but it's very effective for immediate care of the people in the community. So our duty from the head office is to go and distribute items like the immunization, making sure that they got their vaccines, that we supervise them to make sure that it's being delivered appropriately. We also, from time to time, when UNICEF or such organizations give out solutions like salt and sugar solution, because that is what is made up of the normal saline. So when somebody is dehydrated, this is what they are lacking. So we go out there to teach them how you can make it locally. So when we get such supplies, we go and make sure that all the health centers within the local government have got this supply to make sure that the grassroots people are educated and given help. So this has been my job from the head office. Then I think after a year, my boss, Mrs. Amobi, said I have to go and experience working in the health centers. So my first experience was going to Parkland Hospital, which is the general hospital in Enugu. The person there in the small health center there, clinic rather, was on maternity leave, so I went to do a cover. So that was my first experience of dealing with being head of a health center or clinic. I make sure that staff are on duty on time and that the clinic is running smoothly. It was an eye-opener for me because a lot of mothers come there to have this immunization with a lot of problems. People will complain about headache or fever, or all the information that they were given that is not true. So I have to inform them and educate them that having the immunization outweighs the complication, the minor complication like having fever, and actually that when the fever comes, it means that the vaccine is working. I was a bit overwhelmed, being young, being unmarried, but also being able to impact this knowledge to people that are already married and have a lot of experience more than me. But it was a big learning curve and I adapted quite well. The important thing is that I left a good leadership trail within the 6 months I was there. The clinic worked better. the staff were looked after better than the person I was relieving, which was not a good thing, because if I leave and the person comes back and doesn't continue that way, then they might have friction. And in that case, it did happen, because when the person came back, it didn't continue the way I was, and I was told off basically by my boss that I didn't follow the trend. But hoo-ha, that was my stint there. Then I went on to go to Owani Health Center. There I met one HCA, healthcare assistant, that I'm friend with up till now, Mrs. Ifediora. She was very resourceful. She was very knowledgeable. She taught me a lot, even as a qualified nurse and a midwife. It was there that I learned how to do circumcision. I was afraid to do that, and she said, "You must, because it's expected of you to learn." She said, "I will guide you." So she would tell me what to do, because she has been taught by the other qualified nurses before I came. And I listened, and I perfected my act, and things went smoothly. I'm ever grateful for the way she pushed me to learn. I moved on from there to Asata Health Center. There I worked with Mrs. Ifediora again. We did a lot of deliveries there. We did night shift together. It was a lot of good stuff. I didn't regret ever working in the health center. Working alone made me to stand up for myself, deliver services that is needed, and actually have a lot of confidence in myself. So this was my experience working in the health center. When people think about health centers, they usually think, oh, it's nothing, it's not a good service, it's where the poor go, or a lot of things. I used to think like that. I used to think, oh, I'm not gonna ever work in health center. But when I did, I opened my eyes that there is a lot of good work that is done there, and it saves a lot of lives. It also saves a lot of unnecessary trip to the hospital where major cases are supposed to be treated. I encourage a lot of people, having first-hand information and having worked there, that is a good service to avail yourself of, and it's also cheap, because in Nigeria we pay for our medical services. So it's better you start from the health center and then progress, if need be, to the hospital. So this was my experience working as a midwife after my midwifery training. So if you are still watching, I know you're interested. Have you subscribed? Have you shared? Have you liked? Please support your girl Agape. We are on a journey, and this period of celebration of the birth of Jesus is a time to share goodwill and well wish to all of us. I will very much want you on this journey, so that when this journey goes viral, you will be there thumping your heart to say, I was there in the first day. I was there in the foundation. I want this to be interactive. I want you to ask me questions. I want you to encourage me. I want you to criticize me in a nice way that will allow me to grow. Thank you so much for watching, and I will see you in my next video. Bye. Love you. Agape love.